Hello, and welcome to Let My People Eat, a podcast that provides satisfying talk about kosher nutrition. Here we clear through the clutter of nutrition speak, arm you with the clarity and confidence to eat, feel, and be your healthiest every day. I am Jill Sharfman, a board-certified holistic nutritionist living in Los Angeles.
And I'm Dr. Andrea Moskowitz, a neuroscientist and psychiatrist in Los Angeles. I use my training and experience to integrate positive lifestyle changes into my patients' lives.
Hey, Andrea.
Hey, Jill. How's it going?
It's going well. This is our first session in the studio after the beginning of the new year.
I know, it's exciting.
It is exciting, but it kind of feels like different day or same day, different number on the calendar.
Uh-huh. Yeah.
Right? But something I did at the end of last year was I did a whole bunch of doctor's appointments.
Uh-huh.
Generally, I do that because, the insurance, you've met your deductible. Mm-hmm. So you want to fill in the rest with any doctor's appointments that you can before the end of the year.
Right.
And I went and saw my general doctor, as I always do every year. And we did the blood work. Mm-hmm. And it came back that some of my thyroid numbers were off. I mean, my thyroid numbers were kind of always in range. Mm-hmm. But this time, some of them were a little bit lower in the range. And the thyroid is so important,
yes,
especially for women's health. So we did some things. And what I want to do today with our guest is kind of explain to people what the thyroid is, what the function of the thyroid is, what some of the things you may be feeling may be attributed to the thyroid not working the way it should, and what can you do about it.
Sounds good.
Okay, great. So our guest today is Tamar Feldman. Tamar is a registered dietitian with over 15 years of experience and advanced training in functional medicine. And we're going to talk to her about what functional medicine is.
Good.
She's a magazine columnist and the owner of a busy nutrition practice specializing in gut health and catering to clients on a national level. Hey, Tamar.
Hi, Tamar.
Hi. Thank you for having me.
Thank you for being here. So
excited.
Yeah, we are too, because this is such an important topic. And the first thing, I guess let's just address what is functional medicine, because that is a different approach. We're hearing it more and more. And how is that different from Western medicine? What is your approach in helping your clients?
Okay, so functional medicine is kind of looking at the whole body from the root, meaning instead of treating symptoms, we try to figure out what could be causing the problem from the core and addressing it. So in Western society, unfortunately, that very often involves dysfunction at the level of the gut. The gut is central to the health of the body in many different ways. The adrenals, we live a very, very stressful lifestyle nowadays, and that can burn out the adrenals, which are so pivotal to health. And that, of course, has a kind of like avalanche effect on hormones. So we kind of look at functional medicine treating the root, and then it has positive effects on the whole body as a whole. We don't think that body comes of separate systems, so to speak. We kind of think it's all one interconnected, and addressing one thing will have an automatic benefit to another system.
Right. Okay. So give me an example. Like somebody comes to you and they complain that their digestion is off. A regular doctor maybe might prescribe a medication to help heal this, whereas your approach would be...
Well, that's not to say that functional practitioners don't ever use Western medicine. It's kind of, we kind of works together hand in hand many times. And sometimes I will recommend that my clients use medications if they haven't started them yet. If their doctor's offering it, I'll say, look, this one could be of benefit to you, and it doesn't mean you'll be on it forever. You could at some point get off of it. But I do try during that, sometimes we just use that medication as a bridge while we're trying to heal the underlying. So for example, I'll give you a good example of what you're trying to understand.
Okay.
If somebody comes to me and says, I just can't go to the bathroom, I'm always constipated. And while a regular doctor would be like, just take Miralax, which I use Miralax all the time in my practice while we're trying to heal the underlying. I think it's important that people feel comfortable, and it's important that they are stooling regularly in the process of healing the underlying. But a functional practitioner will dig a little deeper and say, why is your bowel not contracting properly? Let's try to figure out if maybe you've got something called SIBO. which regular practitioners will look at that as well. But it's something I think that functional practitioners play a very heavy emphasis on more. SIBO means just too much bacteria living in the wrong place. Functional practitioners will take a look at, is there something wrong with the function of the bowel, meaning is there not enough nutrients that support contracting of the intestines, and just so on and so forth, looking at the cellular level, at the microscopic level, looking at different functional labs to see what might be off and fixing it.
I think of it almost more of like detective work, like really getting down to what the root of the problem is that's causing the dysfunction in the body and addressing that as opposed to just putting a simple Band-Aid on it.
Correct,
so, okay, great. Thank you. But we're here today to talk about thyroid. So,
correct.
Andrea, just why don't you give us just a quick synopsis of what the thyroid is,
all right,
and what it does.
So let's start with where it is. So it's a butterfly-shaped gland, and it's at the base of the neck, and you usually are not going to see it. And sometimes, if you get, your doctor will sometimes check for it. And so, just to make it very simple, because it's actually very kind of complicated. So the thyroid produces and secretes hormones, and the hormones are responsible for controlling the speed at which various chemical processes happen in the body. So they stimulate almost every tissue in the body to produce certain proteins, and they increase oxygen use by cells. So a simple way I like to think about it is that in some ways it's kind of like your body's thermostat. So it can control, it doesn't control the temperature directly, but it controls the speed at which different processes happen, which could sort of on a local level increase the temperature. So just quickly, because a lot of people hear about hypothyroid, which is not enough thyroid hormones, and hyperthyroid, which is an excess of them. And those can produce many, many, many different kinds of symptoms. Just quick. So hyperthyroid, which would be like increase the metabolism too much.
So that would result in weight loss.
It can be weight loss. It can increased heart rate, increased blood pressure, feeling nervous, feeling agitated, feeling jittery, kind of feeling like you always had too much caffeine. Increased sweating, right.
Trouble sleeping,
anxiety.
Right.
And on the flip side, and is hypothyroidism. So that's when the metabolism is not going fast enough, and that can produce fatigue, weight gain, thickening of the skin, and depression, decreased mood. I just wanted to just put in a plug for psychiatry here.
Yeah.
So that sometimes some of the earliest symptoms of thyroid problems are not the quote unquote physical ones, but are sometimes the emotional ones. So sometimes you'll see like the anxiety symptoms on the one hand or the depression symptoms on the other. And I'm sure you're going to talk about this tomorrow, but it's like very important because the system is so complicated that it's not just a matter. I think you mentioned that you got blood work and looked at different hormone levels.
Yeah.
So there's a bunch of different tests that are done. And sometimes the test results can come back with the actual thyroid hormone being within quote unquote normal range, but the hormone that controls it the level is up. And so like to that hormone, it looks like you don't have enough thyroid hormone being produced. And sometimes people will have that profile and they'll be complaining of depression.
Right.
So, and it's partly or mostly mediated with the thyroid, but sometimes that's not picked up because of that.
So, Tamar, I'm sure you see people that come in and thyroid's important. That's why I love my doctor, because even though my numbers might be within what's considered a normal range, and maybe one of you will talk about what ranges really mean. It was explained to me that it's like a football field. Mm-hmm. So you could be very close to the goal line and be considered normal as opposed to be at the 50-yard line. I'm a Pittsburgh Steeler fan. That's my sports reference. But, so my doctor actually was listening to me and the things that I was, having issues with. The fatigue, the cold, maybe weight gain, things like that. He was saying, you know what? Let's try and work with the thyroid a little bit and see maybe we'll be able to get you back on track. So Tamar, tell us about your experience with your clients when they come to you and, you look at their symptoms and how it leads you down the thyroid path.
Right.
Yeah. So we always say treat the patient and not the lab work.
Right.
So if somebody comes to you complaining of constipation, cold hands and feet, always cold, classic hypothyroid symptoms, fatigue, hair loss, weight gain, even if their labs are in the quote unquote reference range, which I'll talk about that reference range in 1 minute. If they're having classic signs, I like to dig a little further because they could be having, for example, normal thyroid levels, but there could be something called thyroid resistance at the cellular level, which means that it's not locking into their cells and working. Or sometimes doctors will only run 2 lab tests called TSH, which you mentioned before is kind of like what talks to the thyroid and tells the thyroid to produce the thyroid hormone, and T4, which is one form of thyroid hormone in the blood, but they're not necessarily testing always for T3, which is the active converted form of T4 in the blood. So sometimes, sometimes simple enough, you can ask them to do a retest and take a look at the T3 levels, and you can see that people are low in that. They can have proper levels of the messenger hormone TSH and proper T4, but they're not converting it properly. Or like I said before, they can have proper levels of everything, but they're manifesting clinically as hypothyroid because there's resistance at the cellular level. And there's different treatment approaches to all these problems, but you do have to look at your symptoms, and symptoms can say a lot. Of course, like you said, depression also is another big one. That's an usually early warning sign of hypothyroid. Hyperthyroid, like you said, all the symptoms you've mentioned. I always like to say there's a reference range. I think like for TSH, they put it at 0.5 to 4.5, but everybody's body feels good at a different level. So for you, your body might feel good with your TSH at 1, and even though the reference range says that you can go up to 4.5. So you may manifest as clinically hypothyroid when you hit 3.4, and nothing will be flagged on your lab work, and your doctor will say you're more than fine. So that's something I always like to educate my clients on, that don't just look at the TSH and T4, look at the T3 and look at your symptoms.
Yeah. And it's important to know because most doctors don't test for that. I know to ask for that, but when you go for your regular blood work once a year, they don't go to that next level. Right. So it's important that you ask them to go to that
be educated.
Yeah, be educated always and ask for that next level. Something I find interesting also, a physical symptom of hyperthyroidism is bulging eyes. Which is something that's found in Graves' disease.
Right, which is actually antibody mediated.
Yeah, which means
okay. So the body produces antibodies to certain of your own proteins, and so one of them binds in with the eyes, and it can cause the bulging because you can get hyperthyroidism without the bulging. Right. Actually,
but it's interesting because I have seen cases where people have the bulging eyes, and then they're subsequently diagnosed with having hyperthyroidism. So I find that so interesting, and I didn't know the science behind it, and that's what works. So. Okay, so people come to you and you've identified on the blood work and from their clinical symptoms that there might be some thyroid issue there. So what's the next step?
Okay, so the first thing to make sure always before you start any intensive thyroid treatment protocol is you have to support the adrenal glands. I don't want to get too technical here because we're talking about the thyroid, but again, I'm a functional practitioner, so you can never separate any body system. It's all interrelated. Right. If you just go ahead full force and try to treat the thyroid without, for simplicity's sake, I'm going to make this very simple, without supporting the adrenals, you can end up burning out the adrenals because, again, thyroid means we're getting a little bit, if they were low, for example, and you want to get that thyroid production up, you're revving up metabolism, which is going to rev up adrenals as well. But if they can't produce those adrenal hormones, then they're going to burn out, which is not good.
So you can talk a little bit about yours because Andy and I have brought it up many times, but I always think it's good, especially when we're talking about how they relate to other systems in the body. You know, what the adrenals are, they're located on the back above the kidneys. But, what is their function and why do we need to support them so the rest of the body works the way it should?
Yeah. So the adrenals produce a whole bunch of hormones, but primarily two very important ones are DHEA and cortisol. So that's kind of like the fight or flight hormones, which we need to survive. But unfortunately, if you are chronically stressed and you're overproducing those types of hormones, those adrenals can kind of burn out and not be able to produce enough of those hormones. You can take a 24-hour urinary cortisol and DHEA output to see how the adrenals are functioning. And if you see that they're low, I usually do recommend taking a little bit of either supplements to support them. Sometimes we even use a little DHEA supplementation at very, very low physiologic doses before treating the thyroid. So I kind of put adrenals and thyroid treatment together. It's the foundation.
Right. Yeah. So Tamar was talking about, I believe we've talked about this before, but the fight or flight syndrome, it used to be in the olden times when we were in danger, there was an animal chasing us. We needed that quick burst of energy that that stress, that outside stress caused in order to run away and do something. But then afterwards, when we were back with our families, the stress level would go down. The problem is today, especially with everything going on in the world, we're under this constant stress level, and our adrenals and our bodies never get the opportunity to relax and rest. And therefore, it's not the way things started out.
Right. I mean, at times we still do need our adrenals nowadays.
For sure.
But really, they're there for like physical stresses, and which are usually, they're done. You go back, you recuperate, hopefully. But more when they go up with psychological stresses, that's the problem because it just keeps up for a very long period of time.
Right.
I mean, physical stress can be for a long period of time too.
Right. Okay. So you look at the adrenals as part of this thyroid puzzle that you're trying to put together. What else?
Yeah. Okay. So there's a lot of different lifestyle / nutritional / even environmental factors that can contribute to poor functioning of the thyroid gland, which we then have to take a look at. There's a lot of things that can impair the ability of the T4 to convert to T3, like we were talking about before.
Right.
There's a whole list. I mean, there's iodine and selenium and zinc deficiency. Right. Certain hormonal hormones and medications, for example, birth control pills, synthetic estrogens, different medications are on that list as well, a whole list of them. Pesticide contamination, mercury contamination from fillings. If you're alive nowadays, in my opinion, you're going to have some risk factors that will impair your thyroid, which is why it's such an epidemic.
Right.
Okay. Right. So it's kind of like looking at the whole piece and minimizing that list as much as possible. Right. So if somebody's got a mouthful of mercury fillings and they've got a whole list of medications on that that are on that list of things that impair the thyroid function, if their diet's poor quality, it's cleaning up the act one step at a time. Okay. Which can often allow people's thyroids to heal on their own.
Right.
Not to say that we don't ever get to the point of medication. That's actually my specialty, is helping people figure out which type and helping them, figure out what's going on with that. But a lot of people either want to decrease their dose for whatever reason, or they don't want to start. Let's say they're just in the beginnings of it, or they feel like we said, their lab reference is normal. Maybe their doctor won't even prescribe yet because officially their TSH is normal, but they feel subclinically a little bit hypothyroid based on their symptoms, and it could very well be, like we said, that their body needs to be at a different place to function well. Then we can start with these first line interventions, so to speak.
Yeah, no,
if you want me to go into more detail on them, I can, but I don't, we'll see based on the time we have.
Okay, well, we could talk a little bit about the nutrients. You brought up iodine, which is probably one of the most important ones to include in terms of thyroid health. And there are several foods that are rich in iodine, like fish and seaweed. Yes,
seaweed.
I was going to say seafood, but seafood is rich, but we can't eat that. If you eat dairy, if you do well with dairy is also good. egg yolks contain most of the iodine found in eggs. So if you're somebody who enjoys eggs, can eat eggs, have your whites, but add in it. Make sure you have the egg yolks because there's a lot of good things in egg yolks too.
Right. Other things.
It also has selenium.
Right.
Lima beans are also a good source, along with magnesium and fiber. Let's talk about iodized salt.
Okay, good question. I think the RDA for iodine is 150 micrograms or so.
Small.
There's a whole bunch of people, really smart people, like there's somebody, Dr. David Brownstein, I don't know if you ever heard of him, that believe that the RDA should be 100 times what it is currently. The iodizing of the salt will maybe allow people, because there's been so much depletion in the soil, so they kind of added iodine to the salt earlier in this century, which maybe like helps a little bit, but you know, it's a drop in the bucket of what our bodies need, and we need more iodine because we have the onslaught of so many things that are anti-iodine. For example, bromides and fluoride. So what a lot of people believe is that the iodized salt, because it also contains those other minerals that are anti-iodine, is not really very helpful. Unfortunately, like you said, most people probably, there are foods that are high in iodine, but most people probably cannot meet their needs alone through that if they have something going on already with their thyroid, which is why this is very controversial, but I think most people in the functional world are on board that people that are having some sort of thyroid dysfunction, either autoimmune thyroid dysfunction like Hashimotos, or just something like we said, a poor conversion, they would probably benefit from taking an iodine supplement and not taking their iodine in the form of the iodized salt, but rather using uniodized natural salts like sea salts and Himalayan salt and all that kind of stuff.
Right.
So the usual dosage that I recommend is, between 50 micrograms and maybe even a milligram.
What delivery format is that in?
I like the Lugol solution, the liquid iodine drops.
So you could just add that to water or something and drink that.
Correct,
that. I have Dulce flakes. It's called, I think, sea seasoning. You could get it in Whole Foods. And actually seaweed flakes that do taste a little salty because they're from the ocean. And that I use that in the morning just on top of my eggs, which have iodine too. Just to get that little extra iodine into my diet without supplementing. Just another option there. Okay, so
since you had already brought it up, and this is, I think, a big issue for a lot of women, can you talk a little bit about Hashimoto's and autoimmune disorders with thyroid?
Yes. Okay. So autoimmune disorders, are very much on the rise in the U.S. and in every area of autoimmune disease is on the rise. Hashimoto's is when the body, for some reason, starts to attack the thyroid gland. The usual markers in the blood would be anti-TPO antibodies, anti-thyroglobulin. You'd be surprised, but I often see people, their doctors are just running TSH and T4. They're not checking if there's antibodies to the thyroid gland, which is important for me to know, meaning what is the process that's going on here, why your thyroid's not functioning well? Is there an autoimmune attack or not on your thyroid gland? If there is an autoimmune process taking place, we kind of treat it a little bit differently. From a functional perspective. If you're just going to look at it from the medical perspective, maybe it doesn't make a difference. But from my perspective, it makes a big difference because once we get into the whole autoimmune component, we have to address the gut. The gut is kind of central to autoimmune disease. We have to take a look at if there's any infections in the gut, if there's any gluten sensitivity. I think toxic pesticides also play a huge role. So if somebody's got gluten sensitivity or any infections that we can see in a stool test, if you can fix that and treat that and take people off of whatever they're reacting to, such as gluten or pesticides, sometimes that autoimmune process will die down. Dr. Brownstein believes that the reason why the body attacks the anti-TPO and the anti-thyroglobulin attacks the thyroid gland is because there's oxidation of iodine taking place in the gland. And he believes that if you can quiet down that oxidation fire, the thyroid won't be attacked by antibodies.
So let's talk about oxidation for a minute, just to make sure everybody understands. So,
oxidation is kind of like almost like a fire in the body, I would put it. It's almost when there's certain processes. I want to keep it very simple, but where certain oxygen involved in keeping processes oxidized. Now, very often when chemical processes take place in the body, we have oxidation that occurs, and you need to have antioxidants to kind of reverse that. So, for example, in the thyroid glands, if there's too much oxidation of the iodine, you need to support that with a lot more selenium and vitamin C, which are antioxidants. Those are minerals and vitamins that play a role in fighting against oxidation. So for anybody that's got any autoimmune thyroid disease, aside from taking them off of gluten, possibly, and, taking a look at infections and all that, we also have to support the thyroid with antioxidants. Selenium is a big one.
Right.
Vitamin C, those two.
Yeah. No, that's great. And you said vitamin A, selenium,
vitamin C.
Vitamin C. High doses actually of vitamin C, up to even 5,000 milligrams a day, which is very high.
Up to bowel tolerance.
Over how long?
Yeah.
For the vitamin C?
I'm sorry?
Over how long?
How long of a time period? Like how many months? I usually start people out for like a month or two at that dose, and then we'll go down to about 1,000 to 2,000 milligrams a day.
Right. And I'm sure you do this. So just to caution people who are listening, don't do this on your own. Do this under supervision, because for one thing is that whatever vitamin C your body doesn't use, it basically urinates out. But over time, the kidneys get used to urinating out a certain amount of vitamin C. So if you're on really high doses, which is okay, but if you just stop it all of a sudden, you can become vitamin C deficient if you're not working with someone who knows what they're doing.
Right. Correct.
Yeah.
I don't usually recommend selenium in supplement form for whatever reason. I actually prefer it in food form. So.
Right. Which is like Brazil nuts. Are high in selenium. Right. Yeah. So I'm trying to think what else. But
I usually, honestly, to keep it simple for my clients who are usually overwhelmed, I say just pop a Brazil nut every morning. You're good.
Right. And not more, one or two, but that's it. Like, you can't, there's also a problem eating too many Brazil nuts.
Exactly.
So that's something that most people don't know either. We touched on zinc for a minute, because zinc is also helpful in terms of thyroid function. And also now everybody's definitely on the zinc bandwagon. Iron, right, it helps the body convert an active T4 hormone into active T3. Correct. So make sure that when you get that blood work, that you're also looking at your iron and your iron store levels to make sure that those are where they should be as well.
Correct. Absolutely.
Yeah. And, again, Andrea and I always advocate getting your nutrients from food rather than supplements. But like you pointed out, Tamar, it's hard sometimes to do that and do that well. And especially if your body's not working at its optimal level, you might need to supplement. And okay.
Yeah, I do utilize supplements very often because practically for most people, it's too hard for them to prepare. I mean, we encourage a healthy diet as part of the healing process. I'm going to talk about that. I really want to talk about that today very much.
Okay.
That's pivotal in healing from thyroid disease. But even while we're in the process of healing, most people do need therapeutic, a little bit higher doses of supplements in addition. And it's not forever. We usually just use it for a few months, up to 6 months even. And then most people, when they're feeling better, they're able to taper down.
Right. Okay, so go ahead. You wanted to talk about eating well.
Yeah. Okay. So assuming there's no, I would say most of the time, if it's hypothyroid, there is some sort of Hashimotos, meaning autoimmune component, in which case I like to take a look at gluten. Very often, it's not just gluten, it's also glyphosate. I don't know if you guys have ever spoken about that here on the program.
We did. We had an episode called What the Heck is Organic Anyway? And we had somebody who she runs a nonprofit where she's trying to get glyphosate removed in the United States. So if anybody wants to hear, I don't know offhand what the episode is, but it's called What the Heck is Organic? And we get into that. But go ahead, share with us, because just if somebody hasn't heard that episode, explain what glyphosate is.
Yeah. So I believe that it's the root of a lot of issues that are on the rise in this country. There's a lot of strong evidence that supports this. Glyphosate is also, it's also known as Roundup. It's a weed killer that they've banned it in many other countries. It has, I think in Canada, they've got to get rid of it by 2021, something like that. But nothing as far as, this is the first time I'm hearing today of any like movement that anything's going to get rid of it in the U.S. So unfortunately, they're still using it plenty in agriculture. They use it to spray grains in order to desiccate and dry them out before harvest. I'm not a farmer, so I don't know why or how they need to do this. But the point is, it has a very detrimental effect as it passes through our intestines. And unfortunately, it's even contaminating many organic grains. Now, very often, people who have autoimmune disease, I focus very much on getting rid of the glyphosate because there is enough evidence to me, enough data to support the fact that it is contributing to autoimmune disease by damaging the gut lining. And forgetting, even putting aside any cancer links or anything, which is also very clear, just from an autoimmune standpoint alone, I think anybody with any autoimmune disease needs to be eating mostly an organic diet as much as possible, preferably completely, but at least, looking at those dirty dozen lists and as well as any grains and legumes, trying to choose mostly organic. They have websites where you can, and I also have a little, handout that I put together of different brands and everything that have been tested to be glyphosate free. But that's number one. Anybody with any autoimmune, including Hashimotos, thyroid issues, I would have them off of glyphosate and eating as much as possible organic diet. That's number one, foundation. And then, of course, balanced. You can't be eating an organic diet, but, all carbs and all garbage and processed trans fats, getting rid of garbage, processed food, trans fats. It's kind of tricky for most people to take the step of organic meats and chickens, which I get because it's pricey and it's difficult to obtain. But if you can't even take it to that level, at least choosing imported meats from kosher, those I've researched. At least they don't have the added hormones.
Right. And we did actually an episode where we talked to the owners of Grow and Behold, who are Pasture Raised,
yes.
Hormone free.
I love that. I love that company.
Yeah, it's a great. Actually, I'm getting an order delivered today. They are pricey.
Yes.
So we, obviously, like you were saying, it can't be done all the time and always, but definitely check into it and see, because the stuff is delicious too. I mean, it tastes really good.
The taste is entirely different.
Yeah.
And it's just, it's a lot better for you. Yeah.
Yeah.
But definitely if you can't do that, at least starting with organic of the produce, grains, legumes, and then working your way up.
Mm-hmm. Right. Good. And again, we also want to point out, like, if you have a choice between having fruits and vegetables that are not organic versus not having any, you can eat the fruits and vegetables that are not organic, but if you have the opportunity to choose the organic, that's always the best way to go.
Right. And definitely look at the dirty dozen.
Yeah.
What it lists to pick and choose, because there's some that it's less important. Not that it's not important, but there's some that's less important, and you can, save money on that.
Right.
On that trade-off.
Yes.
Yeah.
Okay.
Yes. So diet, definitely also including, high selenium foods, like we said, making sure that if you're a little bit borderline iron, including iron-rich foods, zinc-rich foods, like we said, supporting the nutrients through diet, and then as needed supplementation in addition. But definitely processed foods and trans fats are also do have to go. And most of the time in autoimmune disease, we do recommend taking gluten out.
Mm-hmm. And are your clients, when you suggest this to them, are they responsive, or is this something very hard for them to think that once they do this, they might feel better, or do you get a lot of resistance?
Right. So by the time they're in my office, I think I'm getting the people that are highly motivated. So I think if I was, in a doctor's position where you're just suggesting things to people that might not necessarily be on board, I think I would encounter more resistance. But by the time they're coming to me, they know they're ready to make changes. They know that I'm probably going to recommend some things that are a little challenging to them, but they want it.
Right.
They want to feel better.
Is thyroid disease, I guess this question's for both of you, is it genetic? Because it's not something that's easy to avoid or prevent, right? So is there a genetic component to it?
I mean, there probably is. I mean, it does seem to sometimes run in families. And look, most things have at least a partial genetic component.
Right.
But it's not like 100%. And almost nothing, except for rare things, right? But almost nothing is 100% genetic. So it's mostly an interaction between genetics and environment.
Right.
Thyroid problems are more common in women.
Yes.
So there's that aspect,
Right?
Which I guess that's genetic, but
Yeah.
I mean, there's so many things that we don't even fully know yet about genes, but it could be the way that you metabolize different antioxidants. That maybe you just there's a genetic component that your mom passed to you that you guys just don't make enough. So both of you had this predisposition that you had iodine start oxidizing. I mean, that's just like one example of many.
Exactly.
How genes can play a role in triggering the process. It doesn't mean that if you know what's going on that you can't prevent it, but you know, it's definitely more susceptible.
Right. There's one thing that I want to add too, that if you are on medication or supplements that you're taking to support your thyroid, there are some foods and other medications that you shouldn't take with your thyroid medication. So I know, for example, iron and calcium should be taken 4 hours away from that thyroid medication. So generally people will take thyroid medication first thing in the morning when they get up, and then they should wait to take some of those other supplements later on. So again, reinforcing the idea that it's always good to talk with someone who's a professional and who knows these things. Tamar, you're in Lakewood?
I'm actually in Edison.
Edison. Okay, that's great, because I know there are a lot of people out there who've reached out to me through email looking for somebody in that neighborhood. So Tamar is there. She deals with... And
I also see people all over the country.
Right, especially now.
And nowadays, you know, exactly.
Right. And so you can find Tamar. Her website is the Gut Dietitian, that's spelled with all T's, .com. So you can find her there, reach out to her. She's also on Instagram at Gut Dietitian. And Tamar, you're coming out with a supplement line later this year?
So God willing, working on it. Yes. I saw very much a need over the last few years. I mean, I've been working with professional grade supplements for years, but the problem is that they're not kosher certified. So we're working on getting some real good stuff, hopefully soon, to the kosher market that contains very, very targeted, I'm going to call it, to specific conditions. Starting with gut specifically and female hormone balance, but thyroid will be included as well. Correct.
Oh, good. Okay, great.
Very excited about that.
Yeah, no, that is good, because it like you said, it's hard to, I mean, it's easier to find vegan ones now.
Right. Sure. Yeah.
But something that, you know, somebody wants something that's specifically certified kosher.
It's very hard. It can be hard.
It's good to have that alternative. Any last minute thoughts?
Just one thing I wanted to talk about medication, because this is something I'm very passionate about. A lot of people don't realize that when they're on, let's say they're on Synthroid, which is T4 hormone, if you're not responding to it, like I discussed, sometimes you're not converting properly to T3. So you can be taking all the T4 in the world. If you're still clinically, like we said, we treat the clinical symptoms, not the lab work. Even if your T4 levels are good, and if you are feeling hypothyroid symptoms, you may need to take a medication that has T3 in it. Okay. So I know they have desiccated from pork, but that's not the only option that's out there. There are other options as well. There's Cytomel, which is all T3. Sometimes adding in a small dose of that with Synthroid can help people tremendously. Of course, we try to first naturally help you convert properly the T4 to T3, but if that's not working, there's medication changes. There's Thyrolar is, I think, 25% T3, 75% T4. So there are other options out there. If you're on Synthroid and you still can't lose weight, still don't feel good, something's just telling you that your thyroid's just not functioning well, you may be right. And just, it's a lot of trial and error sometimes until you hit the nail on the head with the dosage.
Right. And I want to encourage women to really advocate for themselves here and obviously in other areas. But, you know, I've found in my experience a lot of the regular general practitioners will maybe try and send you to an endocrinologist, that they don't really know enough about the mechanics of this, because they know a lot of stuff about a lot of other things. So if you want more answers, please go ahead and advocate for yourself and say, I'd like to see an endocrinologist, or is there somebody you know that specializes in thyroid hormone balance?
And it's important also to ask for an endocrinologist that deals a lot with thyroid issues, because a lot of endocrinologists actually, the biggest part of their practice is dealing with diabetes.
Right.
For obvious reasons, but so some of them may be more or less on board with dealing with thyroid.
Right. So anyway, I want to just remind everybody to follow me on Instagram at Jill H. Scharfman. I want to thank our engineer today at the Network Studios, Mike Cassantini. Tamar, thank you so much for joining us. We'd love to have you back at some point to talk more about the gut issues, because as you said, that's so critical in so many functions of the body. And I know a lot of people are suffering also right now. I think it's ramped up because of the COVID situation. So we'd love to have you back to talk more about that.
Definitely.
I would love to.
Great.
Thank you for having me. This was great.
Thank you.
All
Bye.
right.
Bye.
Be well. Take care.
And that is it for this episode of Let My People Eat. Please visit our website at letmypeopleeat.com and leave us a comment. Get in touch at our email at podcast@letmypeopleeat.com or call us at 317-659-0004.
We are also on Facebook. Search for Let My People Eat podcast to join the discussion. You can ask questions and suggest topics you'd like us to talk about in future episodes.
If you like this show, please make sure to leave us a 5-star rating and review on iTunes, and tell your friends and family to subscribe to us on Apple Podcasts. Let My People Eat is proud to be part of Jewish Coffee House, where you can find your fill of stimulating podcasts dedicated exclusively to Jewish content.
Please remember that while we are certified professionals, this is not a medical advice podcast. No content, posts, or comments should be interpreted as professional guidance. Always speak to your own doctor about making the right life changes for you.
Until next time, I am Jill Scharfman.
And I am Andrea Moskowitz.
Thanks for joining us, and go in good health.